Hello, everybody. This is Terry, Premom Community Manager with special guest Monica Rincon, Fertility Awareness Method Instructor, here to talk to us today about the basics of male infertility and fertility. Welcome, Monica.
Thank you so much for inviting me again. It's a pleasure to be here.
If you're watching on YouTube, I want to remind you to like and subscribe. And also, you can find Monica right inside your Premom app. If you go to More and Schedulation, you can find her under the Fertility Awareness Method Instructors. So let's jump right in, Monica. I know this is a very important topic that sometimes is not addressed enough. I know you're going to talk a little bit about basics of the reproductive system for males, and then also go into some of the testing and also explain, very importantly, some of the testing for males and what the results mean when they get those results back from those tests. So let's jump in with the reproductive system of the males. What do we need to know? A male wants to get pregnant with his partner. What does he need to know?
So we're going to talk, as Terry says, about male fertility. So how male fertility starts? Male fertility starts as us in puberty. Men, as you know, they're organs that produce the sperm of the cells that were going to fertilize the egg. And so a woman can conceive a baby are called the testes. They are downed in like a bag or a sac that is called the scrotum. We know that the most important thing in the testes is the sperm production and the production of a hormone called testosterone. Men always produce sperm even until they die. It's not like us that we're cycling in our menstrual cycle. Men are always fertile and they produce tons of one predominant hormone that is called testosterone. The testes, the main function of the testes are to produce sperm. This is the cell that is going to fertilize or penetrate when an egg is released in a woman. And that's what it makes the woman to get pregnant. But the sperm as well, the production of the sperm depends on production of the hormone that I already mentioned, that is the testosterone. Something very important that we need to know is that men as well as us produce FSH, that is called follicle stimulating hormone. So the brain sends the follicle stimulating hormone into the testes to start the production of a sperm. And as well, the brain has to send all the time, depending on the feedback, an LH, the same that we do with LH strip in Premom. Men produce LH. And that LH makes the testes to produce testosterone. And testosterone is going to help in the testes to the maturation of the sperm as well. So if there's enough testosterone, like as soon as after puberty, in puberty, men produce 10 times testosterone more than in their adult life. So if there's enough testosterone, the testosterone is gone into the brain, and the brain won't produce the hormone that will give LH and FSH. But if there's not enough testosterone, LH and FSH is going to be produced. So men always are producing sperm, their cells. It takes 74 days to produce these sperm, but men are constantly producing. That it will be the main characteristics of the male fertility. Next slide.
That's really neat.
Thank you.
Oh, I want to touch on a couple of things there. I love that you explained that we have the same hormones. Women have testosterone, men have the LH. That's important to getting that reproductive process started. They also have FSH. And I like how you said it was how many days it takes to generate
74 days, but they are producing all the time. And really, the male reproductive system is designed to give up. So they constantly have to give up this search of, giving the sperm away. And that's the reason that in puberty, during the teenagers' age, they have these nocturnal pollutions and they have these concentrations It's not something that they are thinking about anything, but it's just the body is, producing and making. So that's the reason when women, the couple go for a fertility consult, they will say, well, we need to test the men as well, and they need the semen analysis. And 3 days is kind of the average to know that men are always producing sperm all the time. Yeah.
And now you're going to talk about the most important factors for male infertility.
Yes. So something that we need to take in consideration is that if we say 100%, the 100% of cases of infertility in a couple, 20% only are related with male infertility. So what are the main factors that affect the male infertility? So first, it could be the semen analysis. We need to in consideration that semen analysis means testing two things. One is the sperm, the sexual cells able to fertilize the egg. And the second is that sperm has to go with some liquid, something that is nutrient for them, and it allows them to swim. The same like women need cervical mucus in order that sperm, when is after ejaculation, is just deposit at the entrance of the uterus in the cervix. There's cervical mucus that allow them to continue traveling to reach the egg. So the sperm analysis, we're looking for how the sperm look like, and how are the seminal fluid is optimal for the survival of the sperm. Now, men produce sperm in millions, but not all of them are effective. And I will see this one. The second factor that I want to mention is how the penis and the testes are working. Men could have erection and an ejaculation. We know they're working very well, but we don't know if the inside organs are working perfectly in order to make the fluid that accompanies or goes with the sperm are in optimal conditions. So men has two organs inside that are called the prostate and the seminal fluid. They produce the fluid that allow the sperm to be nourished, have nutrients, it have vitamins, it have a lot of things that are important for the survival of the sperm, and really is really good for the women. There's some studies have shown that is important for the woman because absorb all those nutrients as well in the reproductive organs. The third factor that is very important and is something that the couple can take in consideration even when they just start trying to get pregnant is to measure the environmental factors. As Terry mentioned, as the semen analysis is this is the basic. It's important to know that the semen analysis is sperm and seminal fluid. This is composed of 1 or 2% of sperm, 60% of seminal vesical fluids, so they can swim, and it has 40% of prostate fluids. So when the sperm is produced in the testes, they have to travel in these baths and they have to go and receive all these nutrients before they are ejaculated. Okay? Now, let's see in detail what is the semen analysis. So a normal semen analysis will have these data. Normal, it will be between 20 or 150 million, but it's still normal if even is 15 million of sperm per milliliter. The volume is around 1 milliliters. That is the amount that the men ejaculate. And later, after 20 minutes, it will create a liquefied, so it will get like a liquid. It is important to determine how many of them are motile. Women only produce one egg, like 99% of women produce one egg in each cycle. Sometimes 2 eggs can be released very quickly, but men produce millions of sperm, and you just need one to fertilize the egg. So some of them are defective. So in the semen analysis, we need to see at least how much of that percentage of these 15 millions, for example, or 20 millions are enough to fertilize the egg. So we need to have that morphology at least would be 4%. So how we do this? For example, you have semen analysis result that is 20 millions. From these 20 millions, you need 10 millions that are motile. So they really can swim and move very perfectly. As you see, the sperm has a head and a tail. And that's what we need to see, that this tail is really going undulating movement. We need only 50% of them. Some of them don't have really good morphology, and I have here on my right some examples of that. So this is depending on how, when we do the stain, we really take kind of the picture of the side, or where the side of the sperm is. So coronal view is like this, so they are like a balloon, and sagittal view, it will be like pointed. And there's an acrosome that is called the tip of the sperm that is required to penetrate the egg. So that is other characteristic that is important in the sperm. So if you see here in this one that I'm pointing, if you see it, the size of the sperm is really good, is the perfect size. Number two is too rounded, so it is an abnormal. This one is too big, the egg is too big in number 4. Number 3 doesn't have a tail, so that's what we call is not a good morphology. You see number 1 on the picture C is too long. I have the same side of the circle for all of them, and this one cannot fit in the circle. So it's too long as the side, as the tail. And you see this one, number 5, that as well is too big, and the tail is kind of sideways. So for example, if I count these, each of them represent 1 million. So I have 2, 4, 6, 8, and 10. So from these 10 millions, I only need 50% that have good motility. So I need 5 of them would be with good motility. So this one probably would be a very good motility, and that's what they do. These ones are a very good motility. So that is what you need, what the technician will do. Normal morphology is only 4%. So if you have 10 millions, 50%, 10 million, 50% will be 5 millions. 10% will be from 10 millions. 10% will be 2 millions, and 5 millions will be 1 million. So exactly this is the amount of the total concentration of semen that you really need to have with good morphology. Normal morphology. Another thing that we need to measure is the pH. It should be neutral, around 7.2. And it should become liquid. So there are other tests, but this is the minimum that you have to see if you have a semen analysis from your partner.
So this is a pretty important and common test that's recommended once we're making sure that the male is looking okay in the relationship. So if someone gets a report back, and I've heard women say sometimes, I got the report back and nothing was explained to me. Like, what are the major red flags here that they should definitely be noticing in their report?
Okay, so concentration, at least we expect that it would be greater than 20 millions per milliliter. If it's still 15 millions, it's okay.
So, okay.
Yeah, the percentage of motility, it should be at least 50%. So if it's 70%, it's really good. If it's 40%, it's kind of in the baseline. It's not that bad. Okay. But it's important. Okay. Normal for morphology, so those are very, very fit, and the ones that are going to look for the egg, at least it should be 4% of the total number that they reported to you. So you can do just only 10% is easy, you just go 1 decimal and half of that, and you will make sure that is exactly what they are reporting, okay?
What's the difference between the and the regular? You have normal morphology, and then you have morphology.
Morphology. So morphology means that at least 30% they have a really good morphology as well. So for example, If they say this is what we expect, at least more than 30%, but at least 4% is okay. Okay.
Oh, okay.
Okay, morphology, yes.
Okay, so then for these factors you just mentioned, if they get their analysis and they look at those red flags, they notice they have some, what's the next step after that?
When they need to see the pH. The pH should be neutral, between 7 and 8. If it's acid, the acidity will kill the sperm. You know that men has a combo. They have a urethra for ejaculation and from urine. We have different. We have vagina for our sexual intercourse, and we have urethra for our urine. So some of these liquids that men has to produce, there's a bulbourethral gland that it has to send and clean the urethra. So when the sperm comes, it is not burned by the acid of the urine. So that's what is so important to see what is the pH level. Okay?
Okay,
and
so
we need to...
If they get the report and the numbers are too low, or the percentage is too low, or the pH is not neutral, what's the next step?
So the next step is that if something or here is not normal, the doctor will do a hormonal assessment. I can jump into the hormonal assessment to show you what is the important thing. So because FSH is the follicle stimulating hormone and increase the sperm production, so we need to measure how are the levels of FSH. Only doctors will send you an FSH on blood on your partner if the sperm parameters are abnormal. So you need to ask for that. You say, okay, I receive it. I don't like it. Can we ask for an FSH? Okay. When there's a low concentration of sperm, it's less than 15 millions. This is a red flag. Okay. As well, they need to test the LH because the LH regulates the testosterone. And testosterone are very important for the production of sperm. So they need to measure the total testosterone, LH, FSH, and free testosterone and prolactin. Those are the 4 hormones that it be tested. Okay, great. If the parameters are abnormal. Now, this is only hormonal. The other part that it has to be tested, that men can do the test for themselves as well, is a physical exam of the testes. Why? We need to see that the size of the testes are normal, because that determines the capacity to produce sperm, the consistency that they need to have, the temperature, that the testes are really descendant, they are really in the scrotum, and always are 2 or 3 degrees below our temperature of the rest of the body, that the circulation is good. So here you can see in this lower picture that this should be how the vessels should be, the arteries and the capillaries and the veins. And here when they are inflamed, if it's this inflamed, the sperm cannot go because it's inflamed. It's the same like when you are inflamed in a knee, you cannot walk. So it's the same how they're going to be produced if they are not. So something that it needs to be. And that is very common and is easy to fix by a neurologist. The same, they can have a twisted sperm cord, and only a doctor by touching the wound detected that it has happened. So that is what is called a torsion. Men can have tumors and cancer as well, and it has to be touched by a doctor, or they can do a self-examination as we do in our breast to see if we are suffering from them. As mentioned, hormones, like we talked before, it could be contamination. So something that they're drinking is poisoning, or there are toxins that are producing that inflammation. And something that they need to be tested is if there's urinary infections, or if they have previous STD, which damage any of these very important organs or system in the reproductive male.
So for some of these, they can test themselves. Is it easy to find something online to like go through it with them for how they could test it?
If there's pain, there's something wrong. It shouldn't be pain. If there's pain of they have a bruise or a hematoma or something like that, it is important to be attentive. The same There's some environmental factors that is good that the doctor they are seeing for after 6 months trying or 1 year trying. They need to know this. So there's things that we can start doing before even they try to get pregnant or in the first months. It's like we have to reduce some lifestyle factors that can affect alcohol, affect the production of sperm, as well as cocaine, marijuana, cigarette direct, and pesticide. What are pesticides? Pesticides are endocrine disruptors, chemical endocrine disruptors. You can look on Google and you can see and check in your house if you have any of them, like plastic that has PVA, pesticide, detergents that you use for your clothes. And so if you're using a detergent that has any kind of these endocrine disruptors, the testes can absorb that and they will produce, the man will be a prevalence in estrogen instead of testosterone, and you don't want that. Toxin, some men start using some kind of treatment for hair loss. And the hair loss sometimes is related with the amount of testosterone that men are producing. So they want is the hair, they use that, and they are affecting the production of their sperm. Steroids. So steroids are a type of androgen. It's a type of testosterone. So your testis needs to produce testosterone. So you're giving artificial testosterone. So you're kind of atrophy, kind of not letting your testis to produce testosterone. So you're affecting your LH, you're affecting the other hormones in the men. And this is very important. If they use it in earliest years before getting married, it's important to be honest with the doctor about that, because that could affect. It's the same like when we take artificial hormones for contraception, they affect our health. It's the same. So if they are taking extra testosterone. Nutrition, very important to have a healthy weight, a healthy lifestyle. If you have accidents, maybe in those accidents something happened, there was a bruise or something that damaged part of the production of the sperm in the testes, it should be, it could be fixed by surgery or something. There's some very important health factors like type 2 diabetes, insulin resistant, very high levels of sugar in the blood will determine the viability and mobility of the sperm. Men can suffer from depression, and even when a couple is trying to get pregnant and there's more 6 months, and everybody's looking at itself, what will be the problem? So they can suffer from that. So overweight, underweight as well. Excessive heat. What it could be the excessive heat? It could be taps, if the man is sitting all the time, if he's driving all the time, if there's not enough space even in their clothes for the testes to be down and be fresh, it's very important. The sperm is produced at 2 or 3 degrees below our temperature of the body. There's some question about cycling, but there was a research that proves that it doesn't affect really the production of a sperm because of the sitting. You think that they will affect, but it's not. And this is all that I have to share today.
This is great. So, Monica, some of these things men should be checking right away, probably in general, but especially if they want to get pregnant, if they want to have a baby with their partner, like their environmental factors, if there's any pain that they're experiencing in the reproductive system.
The history that they have, to be honest with themselves, the couple and the doctor, to be honest what it was. Some of us sometimes make decisions that we didn't know. We just did it because we thought it was the best for us. And it's important to, to be sincere and honest upfront, because the journey is going to be easier. And the sooner you kind of take into consideration those things, the easier will be the journey and the help will be faster.
And you provide some very nice checklists in here that men can look through to see some areas they may want to look into further or may want to get tested. When do you recommend that a male go for a sperm analysis? At what point do you think it's a good time?
Okay, so it depends. In the general infertility kind of for counseling, it should be 1 year having random intercourse and the couple cannot get pregnant. But when you're using like fertility awareness, using Premom, when you know what is the peak of fertility and you have been trying for 6 months, I think both of them should go. But at 3 months, if you're getting impatient, the best thing is to go to a semen analysis, ask for a semen analysis, so you will know already if you can improve or you're all right. But I think the environmental factors, the health factors, we need to take in consideration as soon as possible.
Okay, environmental factors as soon as possible. And if you're actively trying, you could check as early as 3 months, at least by 6 months if you haven't gotten pregnant yet.
Yes, exactly. Because when you're measuring infertility, men only, it can be 20%, women could be more, but the couple together could be 40%. So it's important to test the couple at the same time as soon as possible, 6 months at least.
Good whole picture. Mm-hmm. Give yourself the best chance possible, right?
Yes, because you want it.
Yeah. And what is the biggest takeaway that someone should get from your presentation today?
Well, men are very important in our life, and not because we want to get pregnant and we want to have a family with our loved one. It is just the time, always is the time to take care of our men. It's very important. And as soon as we are very wanting to learn about our fertility, let's put into their shoes and try to help them to have a better lifestyle, a better health, and healthy. So whatever they go, they're healthy, and that's what we want for them as well. So takeaway message is always look at the environmental factors, always look for help, and knowing is better to walk with your partner, knowing that just not knowing because you don't know where you're going.
Thank you, Monica.
Yes. Okay, thank you so much.
If you want to come back and check again at some of these slides, you're welcome. Make sure you come back and check this information. There is a jam-packed amount of facts and data in here. And if you are on YouTube, I want to remind you to like and subscribe so you can get more awesome content. And also remember that Monica is right in your Premom app. She's under Fertility Awareness Method Instructors if you go to more and schedule a consultation. If you want to ask her some further questions, get some personalized assistance, she's ready and available for you. Thank you again, Monica.
Thank you.
And thank you everybody for watching.
Thank you so much. Okay.
You're welcome, and we'll see you again soon.